Good day, everyone. Welcome back to this space. Thank you so much for joining us again. Today, we want to talk about importance of antenatal care for a healthy mother and child. Once again, we want to appreciate you for always joining us, and also we want to appeal that you share this video to your loved one, to your family, to your friends, to make sure that as much people as possible benefit from what we are doing on this channel. We believe that information is power, and especially as regards to our health, the more we do, the more results we see. We want you to join us on this service to humanity by sharing our videos. We are available on YouTube, on TikTok, on Facebook, as well as WhatsApp. And please don't forget to follow us on all these social media platforms, and especially kindly subscribe to our YouTube channel. Thank you. When we say antenatal care, it means an important part of the preventive health care for a pregnant woman in order to ensure a healthy mother, baby, family, and the society at large. Because of course we know that if a woman is pregnant, the outcome or result of that pregnancy is going to affect her health and her overall well-being, as well as that of her husband, her family, and in fact the entire community at large. So this is why antenatal care is very, very important for every pregnant woman. We want to quickly look at the aims of antenatal care. So the first one is risk assessment. So whenever every pregnant woman go for antenatal visit, the healthcare personnel attending to her will make some risk assessment to check if she's at risk of developing some complications as regards to her pregnancy. Second thing is to ensure that mother is healthy. There are some parameters that will be checked, her vital signs, to be sure that she's healthy. Also, antenatal care helps to detect and treat associated diseases. It helps in anticipation, early detection, and treatment of complications of pregnancy. It also helps to ensure birth of healthy baby. It gives a room for the healthcare personnel to listen to mother's concern. And last but not the least, health education. In this part of the antenatal care, the healthcare personnel give the pregnant woman health education that will help her during the course of the pregnancy, during delivery, and during the childbearing, as well as breastfeeding, and subsequently as regards to family planning, child spacing, and the rest of those things that are required to ensure that every woman is healthy. It is important to note that onset of every antenatal care visit starts with booking and registration. This is the first official visit a pregnant woman has by going to the hospital after confirmation of her pregnancy with obstetric ultrasound scan, which is the only ideal way of confirming pregnancy. It is important to know that booking and registration is done in every woman's first official visit to the healthcare center. This is when she will be registered for this antenatal care. Some investigations will be done. One of it is the ABO blood grouping and resource factor. This is important in case of women with resource negative to ensure that they do not have resource isoimmunization due to resource incompatibility with their husband. Also, another thing is hemoglobin genotype to detect those who are SS or SC and be able to plan for them very well during the pregnancy and during the delivery. Also, some investigations will be done as regards to infectious diseases such as HIV, hepatitis B virus, venereal disease research lab, which is for syphilis, malaria test, ultrasound scan will be done, which is also very important in dating of the pregnancy. So the more early the ultrasound scan is done, the more accurate the gestational age could be estimated. Random blood sugar will be done to rule out gestational diabetes mellitus or diabetes mellitus in the woman. There will be urine microscopy culture and sensitivity, which is urine MCS, which is important in detecting urinary tract infection. All this will be done for every pregnant woman as far as investigations are concerned.